Hey guys, John here. Black Wednesday at Titan Medical Center. Titan Black Wednesday. So it's our second year doing this. Awesome experience for you guys. It's great for us. We get to interact with our patients. We get to give away a lot of stuff with our patients. What's up, PG? How you doing, man? So guys, the Black Wednesday Titan specials. There's a lot of specials. If you're a new patient, you're an old patient. What up, Eric? How you doing, man? So there's specials for everybody. We're going to be giving away free blood tests again. We've already gave away a lot of free blood tests in the first two lives. We've gave away free visits, amino visits, a lot of Titan apparel. So at that point, we want to give you guys as much as we can, and we want to do it before Black Friday hits for you guys. We want to make sure we can at least help you guys out before the holidays. So this is what we're doing for specials. So for specials, male blood panels and female blood panels are discounted at a rate they've never been discounted to before. Nobody can match it. I can guarantee it. Apples to apples pricing and what you're getting. So at that point, you're going to get a full male panel, and that includes all the testing that we do. And at that point, that panel is usually $200. You guys are going to get it today for $130. Usually it's only discounted at $150. So this is a super discount for you guys to take advantage of. It's got all the testing you pretty much need as far as liver, kidneys, prostate, electrolytes, thyroid panel, T3, T4. It's going to have cholesterol panel in there. It's going to have free and total testosterone, estrogen levels, progesterone levels, IGF-1 levels, and B12 levels. And if you don't know what any of those tests mean, our medical providers are here to help you understand what they mean and understand what you can be doing to optimize your health and to get better and feeling better, looking better, and performing better, because that's what it's all about, guys. So at that point, this show, we're actually hopefully going to get to go mobile, and it's going to work properly. We've been working on it, or it has, pretty diligently today. So Titan Trade, what's going on, man? Nice to see you on here. So at that point, that's what it is. Mike Kopko, excuse me. Eric's on both. Wow. What's up, guys? So the blood work, male panel, discounted to $130. Discounted to, it's never been discounted before to that rate. Female panels, $300 usually. We're doing it for $195 for the females. And the reason the females panels are a little bit more than males is because there's more blood tests on those panels. So it's a more in-depth look at what's going on inside their body, because we have to look at a couple different things more than a male. Yes, females can be a little bit more complicated when it comes to hormones. A lot more different effects going on, I would say. We all have the exact same hormones. It's just hormones in different ranges and different levels we have in our body, and they affect us in different ways. So at that point, we want to make sure you're checking out all the things you need to check out. Guys, if you guys are just joining us, please, on Facebook, down in the corner, right down there, please share it. Share it with 3 friends that can help, or family members, or just somebody you think could benefit from Titan Medical Center and all the great therapies. Doctor prescribed, monitored, coming from a real U.S. licensed pharmacy in your name to you, the best way we can do it. We're here for you guys. There's also, as far as support, 24/7 usually, text messages, phone calls, emails, and I'm not talking about robotic texts. We are talking about a real person talking to you, texting you, making sure everything's all right. And at that point, if you have an issue, we have the medical staff here that we can provide, medical licensed practitioners, doctors that can help you achieve these results and make sure that you understand everything that's going on with your medications and your regimen to help you get the optimal result and what it is, right? So our doctors are a little bit different in that light as far as they look at preventative now. Some of these doctors have came from the family or general practitioner area, and at that point got into hormones, and at that point understands the benefits and everything that's positive about hormones. These hormones are produced in our body, so there should be no negative stigma about it. Yes, people can abuse things, that's true, but at this point, we are doing it for health here, and we are doing it for people to feel better. I talked to a 67-year-old woman today, and she's at her end's wits. She wants to feel better. She knows she can feel better. She was a competitive athlete when she was younger, so she knows what her body is, and she knows how her body works. but she just cannot get the results, and she knows that it has to do something possibly with hormones. And at her age, of course, but at the age of 30, even in males, we know that we're losing at least 1% every year, if not more. And then what are you at already? Do you know the starting point of where you're going down 1% from? That's the cold hard facts that you should know, because not everybody is starting out at that high at 1,100 or 1,200 and going low. They're at 500 or 400 and going low 1% every year, or possibly declining faster than that. It really just depends on the person and their background, family history, everything that's happened to them. A lot of head injuries now. We know the pituitary, is a big function for our body as far as hormones and all that. And damage to the pituitary can happen a lot of different ways with head injuries. MMA fighters, pro athletes, football players, people that just had nasty accidents. I mean, at that point, hitting their head and rupturing something or something damaged in their pituitary or their brain can mess with a lot of different things in their body too. So it's just, I can't harp on it enough, guys, get checked out. So that's the blood testing portion. We go over the therapy of the week was Titan Ultra with NADH, carnosine, but I know I'm just talking like a broken record about those things. So you guys can look up the YouTube videos and just, read about Tighten Up, Titan Ultra, Hercules Potion. If you guys have any questions about it right now, I'd be more than happy to answer some of them after I get over with everything we're doing here. I'm going to give away some free Titan gear here very shortly. Girls' leggings, tank tops, guys' shirts, whatever you guys want. Titan gear. I'm going to give it away. We also got hats. We've got Nike hats, Nike fitted hats, black, white. We've got camo, flat bills. They're adjustable though. They're not fitted. So at that point, if you guys want some of those, we got awesome V-necks. We got loyalty shirts. We got a lot of different stuff. Deanna's on it. Look at it. She's like, Titan gear. Awesome. So let's start off with that. I want to start off with giving. So hashtag Titan gear. What I want you to do is hashtag Titan gear on here, or you can text the phone number 727-389-3220. I'll pick up winner for the Titan gear. Okay, so I'll pick one on Facebook and I'll pick one on Instagram. So at that point, I can give one to each. I want to make sure that you guys get the Titan gear. So I hope you guys like it. So girls, we have a ton of leggings, brand new ones. You guys are gonna love it. And if we don't have your size in on some of the ones that you want, we're getting a new shipment in very shortly. We got headbands coming in. So we have some really, really cool stuff. I've got some really, really cool stuff planned for Titan Medical Center in 2019. I'm gearing up and getting ready. We don't stop here. It's 24/7. Me and Sharice are on the grind, and we're constantly looking for ways to better this practice. We're constantly looking for better ways to help the patients. We're constantly looking for better therapies, cutting-edge therapies, new therapies. Why aren't these doctors using these therapies? Like glutathione. A lot of people with liver enzymes, high liver enzymes, fatty livers, they just, they can't get those liver ranges in range per se, or they can't get them down to where they need to be. And it's causing them other health issues, where a primary care general practitioner is never going to talk to you about glutathione, which is a super antioxidant that can help bring those liver enzymes, ALT and AST. And if you want to know what that is, you can refer back to my other lives, because I talked about it. Liver enzymes. We're going to have our doctor on here in a couple weeks to go over full blood panels so you guys understand what it is these blood tests mean and how they affect your health and what is going on with you. So at that point, you'll have some education in it. And if you ever do go to another primary care, or when you do and get a physical or whatever you're going to get for a job, you'll know exactly what the test is that they're running on you and exactly what to be looking for. So I want to give you, some behind the scenes peeks on, the blood testing and what it is. It's really interesting, and I think you guys should know, not just, hey doc, how was my blood test? How did my blood work look? Oh, it looked good. It was great. It was good. Okay, it was normal. Awesome. What does that mean? Do you want to just be normal, or do you want to be optimal? That's your question. If you want to feel like garbage, and a lot of people do, and a lot of people do not want to feel like that. So they make up for it in a lot of different ways. A lot of people use a lot of different caffeine stimulants. They're drinking a lot of coffee. They're drinking a lot of Red Bulls. At that point, they don't know what's in some of these things, like carcinogenics, bad things, and some of them. And at that point, they're damaging themselves a little bit more, and then they're building their tolerance on caffeine and these other stimulants that they don't really need to at that point. And if they're going for weight loss, there's a lot more effective weight loss ways out there to do it. So, just take that into consideration. All right, guys. I want to show you guys some behind the scenes of Titan Medical Center. It's 6:13. The Titan Medical Center officially closed at 6 p.m., but we have West Coast patients. We love our West Coast patients. Big shout out to them. So, they're 3 hours behind. So our staff, we do have staff members that stay till like 8 or 9 o'clock usually. And this is Thanksgiving Eve. Tomorrow is Thanksgiving. So at that point, we are always here for our patients. That's a big thing that we pride ourselves on, is being here for them and being here for you guys, so that you guys get the care and the standard of care that you guys deserve, not just being a number. So at that point, I'll show you kind of what's going on. All right, you give me the go ahead, and we'll rock and roll.
All right, we're moving around.
Okay, so we're good? Awesome. So I'm going to walk Instagram. You're going to walk with me. Sorry, guys. All right. So we're walking. So if you guys don't know, we got the studio here. My man, Jason Skeldon, he does all these paintings for me. They're really cool. Does them custom, so they're really, really nice. I gave some to a couple of my good friends. So our office is like 4,200 square foot. And, like I said, we're kind of closed. So at this point, the consultation rooms, really nice. This is our workup room for our vitals. So at this point, it's really cool. It's all plush, so you get a first-class experience in here. We have a Seeker machine for our patients, and this tests for a number of different things like hydration levels, body fat percentages, how much muscle is in one arm compared to the other arm, legs compared, visceral fat. It's got a lot of different benefits. So when you come on this, you can see, how your changes have been through this, right? This data, and then through blood work. So we're going to keep walking, right? All right. And we have our, motivational piece up here. It's all about finding a passion and pursuing it. So this is really cool. So we're going live, guys. We are live back here. So they're going to get the first-hand experience. Uh-oh. All the girls going crazy. So this is our closet of clothing. It's really crazy. So we've got like 23 girls signed, I think, as Titanettes, ambassadors, athletes. So we do constant events. We'd like to get it out there about Titan Medical Center, make brand awareness about us, really educate people, and try to break down a lot of those negative stereotypes and myths about hormones, particularly testosterone. I mean, it's not all about testosterone, guys. I mean, the injectable vitamins, amino acids like curcumin and everything, great benefits. And you should only be doing testosterone replacement if you need replacement, not just because you want to get big and jacked. That's just not a great excuse, and you shouldn't want to shut down your. I wanted to show off Dr. Perez. Oh, so here's Dr. Perez, guys.
Say hi.
Hey, how you doing, guys?
Yeah, I'm sure that most of our patients out there know who Dr. Perez is.
He's been here forever. He's like a fixture on the wall.
Yeah, so Dr. Perez has been with us the longest, and Dr. Perez is definitely he's our little Latino lover. We love him. He's the best.
Love him.
He's the man. This guy reminds me of Mark Anthony, just with a white coat on. Okay.
Just a lot shorter.
Yeah. So hey.
Yeah, I look like a baseball player.
That's right. We love Dr. Perez.
Yeah, Puerto Rico.
So
baseball.
Hey guys, so if you ever meet with Dr. Perez, this is who Dr. Perez is. He's a medical doctor, so he goes over all your hormones and stuff like that. And he's got some pretty good background. And we do well for our patients, right? We want to get them results.
They always get results.
That's right. We're all about the results.
Guys.
That's right. Thank you, Dr. Perez. So we got another little fixture back here, another consultation room. So we have 6 consultation rooms all together. We have a clothing room. We got a beautiful lobby out there. So it's huge. I mean, it's pretty big. There's Ashley. Oh yeah, say hi, Ashley.
Hello.
So you guys talk to Ashley. There's Ashley. We got Emily. Say hi, Emily. We got our new operations manager, Josephine, the bulldog. She's ready to go. Sharice. Say hi to Megan.
Hi.
Megan's
She's not
pretty.
feeling good. Don't let her be on camera.
Yeah. She's not feeling good.
I'm
Who else?
here for the patients.
She's here for the
I'm here
patients.
for the patients.
We are here for you guys. Andrea's back here. It's the kitchen area, guys, where it all goes down. See all those boxes and stuff? It's like our kits. Like, oh man, it's crazy the stuff that we have. Sorry, sitting down. TFX, man, what's up, dude? How you doing?
We're back.
We're back? We're good?
Well, we're good, yeah.
Okay. All right. Switching cams here. All right, cool. I'll get that, actually.
Okay, go for it.
All right, cool. So, sorry, guys. I'm going to put you on here real quick. Give me 1 second. All right, cool. So, blood test. Let's do the blood test. Hashtag blood, right? And you guys should put it on here so we can see it, and we will pick it. Yeah, see some of the patients see Dr. Perez on there. How is it pretty? It's pretty cool, right? Can we use the win for a family member in need? Sure. I don't care. Yeah, that's fine with me. If you want to give your blood test or whatever you want away, sure, you can give it to I definitely. Whoever can benefit, I'm all game for it, guys. So if you guys did it. So hashtag blood. We want to do that on Facebook. We want to do that on Instagram. All right, so the feed should be back. All right, yeah, perfect, awesome. All right, so hashtag blood, and let's give it at least, let's give it 5 minutes or so. We'll see who all puts their things on there, and at that point, we'll pick a winner. All right. So let's talk about sugar levels. Sugar levels are important, right? Silent killers are blood pressure and diabetes. Sugar levels, so your glucose levels. At that point, are you monitoring your glucose levels? Do you have diabetes that run in your family? When's the last time you've checked an A1C or a doctor's checked an A1C on you? So it's very important. So glucose levels, when they come back, they'll tell you, what a range is and where you're going to be at normally, right? So usually between 80 and 90, just depends on what the lab is or where the lab's reference ranges are at. But here's the thing. If you don't fast for the blood test correctly, if you don't fast, you can get a skewed result, right? But if you do fast, and you fasted at least 12 hours, at that point, if you come back high, you better do a hemoglobin A1C. Now, glucose levels are dependent on that day, and they're testing right then and there. Where a hemoglobin A1C is a 3-month average of your sugar levels, of your glucose levels. So that's going to tell you for pre-diabetic, diabetic, so at that point, like, it's a telltale right away. I mean, you can prevent it. If you're a pre-diabetic, you need to make some lifestyle changes. And that's what it's all about. It's all about lifestyle changes. When you're making lifestyle changes, you're making healthy changes, and you get in those routines, you're going to find the things that you do, and you're going to feel better, you're going to have more confidence, and you're going to do things better. It just is what it is. Whether it is, if you're overweight, and you're eating horrible. So if you make changes, and I'm not talking about drastic changes, because shock People fall off that. What up, Rod? How you doing, dude? So when you're in those lifestyle changes, at that point, you want to make the changes and make them subtle. So at that point, do it a little bit more and more and more and more. But you have to keep working up. You can't get at one point and just stay there and plateau. So at that point, keep progressing. Progression's key. I keep going over it. I always say it. Progression is key to life. Keep moving forward, inch by inch, hopefully mile by mile, and farther for you guys. All the way to the top or all the way to the finish line. That's what I always say, guys. So at that point, that's what it is. Hashtag blood, guys. Hashtag blood. So that's what it is. So keep progressing. Watch glucose levels. If your glucose levels come back, tell your doctor you want to do a hemoglobin A1C. I think it's $25 if you want to run it through us. But your doctor, primary care, if you have insurance and stuff like that, you should be able to run a hemoglobin A1C. But if it comes back now, that's on your permanent record. Now, that's a whole different thing. People ask me all the time, they say, John, I got good insurance. Why can't I use insurance? And I tell them the real reason. The real reason is because, A, doctors have to produce diagnosis codes to go along with those blood testings for the insurance companies to cover those blood tests. Otherwise, they either kick it back on you. At that point, you're getting thousands of dollars in bills because these blood tests we run are in the thousands. For sure, 100% if you're doing a cash pay situation with the lab itself, or you have to pay the insurance company for the lab bill. So at that point, without these diagnosis codes, they're not going to get covered. With these diagnosis codes, physicians or doctors have to have some sort of reasoning for the diagnosis code. They can't just say, I think this, and this, and this. They just won't do that. At that point, they don't want to open up a can of worms either for liability as far as that goes. So at that point, you really want to make sure, you're getting these things tested, and they won't test it. There's probably a reason why, or they have their own reasoning on why they don't want to run the tests on you. But that's the main reason why we don't take insurance, because it kind of restricts the doctors here and how they want to treat the patients and what they want to do and what we want to do for preventative. And insurance companies really don't treat preventative, or they don't really cover preventative. They're more about, hey, listen, if it's broke, we're going to fix it. And that's how the general medicine is in Western medicine. That's kind of what it is. Give them a pill, it'll fix this, but he might have a side effect. Give him another pill for that side effect. Give him another pill for that side effect. Now you're on 3-4 medications. It's affecting other different ways as far as possible depression, possible libido, possibly adding weight on you. A lot of different things go along with these medications. Have you ever just sat back and watched the commercials of pharmaceutical commercials, and they just come on, there's they say 1 positive, 2, 3 positive things, all the rest are negatives because they have to legally. It's crazy, man. I mean, of course, if one symptom happens or one side effect, they have to list it. So, better that they have to listen than not, but it's kind of scary that those things could possibly happen, and it gets your mind thinking, is it a placebo effect or not at that point of you possibly getting that side effect when taking the medication. But numbers don't lie. That's why I always say blood test. Blood test will be key in anything you want to do usually. The only blood test, and we talked about this earlier, like ADD or ADHD, there's no blood test to tell you if you have that. There's blood tests to tell you if you're allergic to gluten, food sensitivity test, STD test. I mean, all those different tests out there, but nothing for something like that. It just is what it is. It's chemicals imbalanced, and at that point, it has to be treated. I think it should be treated in some people, but I think, putting all the kids on controlled substances at such a young age and things that will affect their brain or possibly their life for the rest of their life is not the best way to move, I guess. But I guess some of the kids need it, and I'm not the licensed professional to recommend that, so that's why they do, and that's why the kids are on it. There must be some good reasoning. So at that point, I'll go along with what they say. We stay in our lane. All right, cool. So let's do the blood work. You guys got 2 more minutes for blood work. I see a whole bunch of people on here. So blood. T. Rizzo, Bezandra. Oh, man. Wow, there's a whole bunch. I'm just going to scroll in here. Okay, cool. All right, cool. So we got a couple on here for blood. You can enter in a couple more times if you already did it once. But if you're going to enter in a second time, you have to tag 3 friends. Every entry, you have to tag 3 friends, or I'm not going to count it. So if I see an entry, double entry, and you haven't tagged 3 friends on each entry, I'm not going to take it. So at that point, that's what you got to do. So if you're on Facebook, go down to the button down there, press share, tag your 3 friends or 3 groups, whatever you want to do. I don't care. That's awesome. Thank you so much for it. If you're on Instagram, please tag at and those 3 people that you want to benefit from possible treatment with Titan Medical Center. So I appreciate that, guys. So let's give it one more minute. Well, 6:30 we'll do it. 6:28. That way I'm on a time schedule. I like to be structured, guys. It's all about structure. Time management. Time management is a big one, man. What we do, and accountability. Accountability for yourself and what you're doing. So you're easy to just, at that point, self-rationalize and just say, oh, I'll just do it tomorrow. And people get in that rut of I'll just do it tomorrow, I'll just do it tomorrow, I'll just do it tomorrow, and procrastinate. Guys, when you have something to do, try to get it done as fast as possible. I don't mean try to rush through it. I mean, hey, listen, if you have it and you have the time, hit that goal or hit whatever you need task-wise, get it knocked out. You'll feel a lot better about yourself. There's an old thing when it comes back to the Army. A lot of generals and higher up rankings that I knew always would say, hey, listen, the best start of your day is the first time you get up and you make your bed. That's like your first accomplishment and first task of the day, because that's what they do. They make sure everything's tidy. So at that point, it hits home. You start with that and you just move on. And you start just attacking things. And at that point, just knocking these things out. If you forget about things, make a list. I used to make a list. I have my notes on my phone now, so at that point I can look back to that. But your list is everything. And then just knock out those lists. Bye, guys! Change that picture, Art. Please. You can put on anything else. All right, cool.
Noted.
All right, so at that point, yes. All right, so we got somebody. All right. So let's do this. Ready? I'm going to scroll. All right. Betsandra, you have won the blood test. You've won 1 blood test on Instagram. Betsandra. So please, you can call or text the line. Actually, it's after hours, so you're going to have to text. You can text 727-389-3220. You have won the full female blood panel. Okay? So at that point, we just need to get some information for you guys. We'll help you out. Before I go on to Facebook, what I'm going to do is I want to tell you guys what we do. So I get the question every time, every live. We've been open for 6 years. I've been doing these lives for probably about a year and a half now, consistently every Tuesday. At that point, what do we do? We are nationwide. That means we service nationwide. We service nationwide a lot of different aspects as far as blood testing. So all hormones, these different tests like A1C, like I was talking about, progesterone, estradiol, free and total testosterone levels, insulin growth factor 1, IGF-1 levels, prolactin levels, cortisol levels, a stress hormone, right? You guys heard of that one? SHBG, sexual hemoglobin, right? Blood test. And that can affect if you have low free testosterone. Usually an SHBG is ran along with it, and usually SHBG comes back high. So at that point, we can treat that. There's different medications or different therapies that can help. If you want to test some different things, we have food sensitivity testing. So if you have a diet that you're doing and you want to make sure that that diet is going to go right along with your body and work properly and optimally, you can run this food sensitivity testing through blood. When we send you to the lab, you can do all the hormones and the food sensitivity testing at one shot. Let's say you go out and say you have a wild night and you do STD testing. We do confidential STD testing through blood. We can send you to a lab in your area and get you the results fast, right? Discreet. And at that point, if you need treatment, we have medical providers that will treat, or we can do those medications for you so that you can get taken care of and you have no problems. So we love doing for a lot. MMA fighters, they need some of those tests done, right? Like hepatitis and all that stuff. Guys, we do the cheapest for the MMA fighters blood testing around. We will beat anybody's price. So please come with it. Let me know if we can help you out in those areas. Can you use the one for... Yeah, we already said that. All right, so next one. Let's do Facebook. Let's scroll. Let's see. Let me do on my Facebook. And let me pull somebody. Alright. All right. So the first one is, and did he share? So he's got like 2 or 3 on here. Michael Kopko? Yep. So Michael Kopko, you are the winner of the free blood test for the male panel for Facebook. All right, guys. So the next therapy of the week, so next week when we get back from this awesome Thanksgiving holiday weekend, who's excited for Thanksgiving holiday weekend? I'm excited. I'm excited to eat, right?
Oh, yeah.
Yeah, we got to eat, man. We got to eat. So,
Love you.
got to get strong, you know. And I know there's like a turkey outbreak of like salmonella and all this stuff. But I guess on ground turkey, I don't know. Like,
It's a certain kind of.
right.
Yeah.
So don't be scared. Don't let the media hype you up and stuff like that. You know, I was like telling my dad about it. He's like, oh, I think it's just on ground turkey. I was like, I don't know. I was like, and then I looked into it. I was like, oh, yeah. All the romaine lettuce, CDC says do not eat it. So at that point, just be aware of what you're eating or where you're eating it at, and make sure they're feeding you good food. Lean turkey, man, that's what it's all about. Don't add too much gravy or anything on there, stuffings. But if you do, just make sure you work out extra hard the next day, okay? Burn all those calories off. Do some intermediate fasting. Help yourself out. All right, so that's cool. All right, so we're going to give away some more free Titan gear at the end, guys. All right, cool. So is there any therapies you guys want to hear about? Because the next therapy I'm going to tell you about is Titan Complete. So if there's any other ones you guys want to hear about, I'll tell you about some new therapies that are coming. So if you haven't tuned in or you've tuned in to the first 2, you haven't heard this. So let's talk about some new therapies. So let's talk about thymosin alpha-1. Thymosin alpha-1. It's a peptide. It's an FDA-approved peptide. And what it does is it's good for building the immune system. So at that point, thymosin alpha-1, which you might don't get it confused with thymosin beta-4, which is TB500, and that's great for healing and stuff, joints, ligaments, tendons, stuff like that. But thymosin alpha-1 is really, really good as far as that goes. So building the immune system, and who doesn't need a stronger immune system? Think about all the germs. Think about all the superbugs that are out there. Think about, if you have kids and they come home with snotty noses, at that point they're getting you sick, the whole household gets sick. You feel crummy, right? I mean, that's the worst. And then trying to get into a doctor and get antibiotics and all that takes more time. You're down. I mean, you get behind. I don't like getting behind. So I always try to be on duty tomorrow. So I always try to be optimal in my health, especially, I try to do the right things by washing my hands, doing those techniques of sanitizing and cleaning. Excuse me. I'm losing my sanity almost. But yeah, sanitizing and cleaning, making sure everything's good. It's funny. My son, he's been on Thanksgiving break. He got to stay home these last 2 days with his grandpa. Grandpa's not sick. And he's sick today. I'm like, oh my God. I'm like, oh, great. It's every time something happens, you always got to be ready for that curveball, guys. I'm always ready for it. On duty tomorrow. We're not going to be, that's right, guys. We will not be on duty tomorrow. Now, if there's an emergency and you're a patient and there's a problem, text us, 727-389-3220. We'll be able to help you guys out if there's a problem. If not, guys, we're taking off for Thanksgiving for sure. We're going to eat with our families, be with our families. I hope you're going to be with your loved ones as well, or somebody insignificant. Or significant, not insignificant. Sorry. But yeah, so at that point, please. Friday, we will be open, though. So Friday... I was just saying, you'll be on duty tomorrow. Oh, okay. I'm sorry, dude. Well, thank you for being on duty tomorrow. I mean, you're definitely going to be doing a service to somebody, for us out there anyway. So thank you, man. I appreciate it. If we can get you a free shirt just for that, man. If you're working Thanksgiving, dude, I'll throw your free Titan gear, man. Just text the line, 727-389-3220. I definitely want to do something for you, man. Happy Thanksgiving and happy holidays to all you guys. I always say it, without you guys, we wouldn't be here. Our patients are number one to us, and they're like family. Our staff's to us like family and stuff like that. So I want to make sure that everybody's taken care of, and you guys are all good. So I think that's it. I'll do one more hashtag Titan Gear for free. I'll send it out to anybody you guys want, yourselves, your family member, whatever you want. I want to wish you guys another happy Thanksgiving. So just text the line, 727-389-3220. Hashtag Titan Gear. The 10th person to do it from right now will get the Titan Gear, okay? So I love you guys. I appreciate you guys. I will see you next Tuesday for Titan Talk Tuesday. And I'll let you know how my break was, and I'll ask some of you guys how yours was. So I hope you have an amazing holiday weekend. Spend some time with your family or with your loved ones. All right, guys? I'll talk to you guys later. Bye, Instagram world.